Tonight on Capital Journal, state and school leaders are looking at the success of STEM programs, helping students in Alabama find more success in the classroom. Also, Governor Kay Ivey addresses rumors of her lack of appearances and health status. One major Alabama city is looking at bringing economic and residential progress to its area by revitalizing portions of its region. We'll be joined in the studio by Chancellor Jimmy Baker of the Alabama Community College System, Alabama Department of Labor Secretary FITZGERALD Washington, Alabama Law Enforcement Secretary Hal Taylor, and State Health Officer Dr. Scott Harris for the latest activities with their agencies. Capital Journal starts now. From the APTV studios here in the Alabama State House, welcome to Capital Journal. I'm Randy Scott in for Todd Stacy, who has the night off. The new school year is underway, and many people are looking for programs to help students achieve more in the classroom. Governor Kay Ivey got an up-close view of new STEM lab work at Montgomery's Dalrata Elementary School to see students in action.
This is an exciting visit in a STEM innovation lab where students can actually learn engineering and building and science all in one location, and they are doing an amazing job building bridges this morning. So it's a great program, and I just hope we can get a whole lot of these started all over the state. This is an incredible step in learning. Goodness knows when I was in the 4th grade, we didn't build robots. Goodness knows. So we've got a long way to go, but we need to understand what it takes to get there and press on.
Dalrata is the first elementary school in Montgomery to have a STEM innovation lab, and Principal Brian Cutter says it's an important asset.
Well, we wanted to be intentional. We wanted to make sure that our kids have an opportunity to learn and have student engagement. But we saw that STEM was heavily on our secondary levels, and so we had a vision to expose them in the elementary levels to all students. We realized that they need to learn about science, technology, engineering, and math in a fun, exciting, engaging classroom. And so we wanted to have opportunities where all kids, K through 5, can go each day through each 9-week semester where they get that exposure, just like they get music, just like they get PE, because we realized that every child doesn't want to be an athlete. Every child doesn't want to be a musician. So we wanted to tap into their passion, so make sure that we are giving them opportunities to pursue, but they're intentional about learning.
Dr. Cutter adds the students think the program is both engaging and exciting.
They view it as, oh, we're playing a game, we're coding, but they're not realizing that they are learning secondary as well. And so that was the approach we wanted to, where it was an environment where they felt safe, where they could learn through hands-on, through a fun, engaging environment where it's not just so structure and rigor where they have to sit down and do pencil and paper. We wanted them to learn collaboration, teamwork, skills that they need to be successful within the workforce when they leave here, but also in today's classrooms. We see that they're used to working in isolation through COVID, so we wanted to make sure we showed them that through collaboration, cooperation, and teamwork, they can problem solve, they can come up with solutions, and they can be intentional with each other as they're learning.
This week's appearance at Dalrata Elementary marked the first time in several days the governor has been before some reporters. Questions did come up about health concerns, and Governor Ivey had this to say.
Between the rumor mills and some of you guys in the media, it seems like some of you just want to will these rumors into reality, into existence. But I assure you I am fine every day. I give thanks to God for giving me a clean bill of health, and I look forward to serving as governor for another 4 years. I enjoy being governor. We're getting a lot done, and as you see this innovation lab today, there's certainly more work to do. So I look forward to going full speed ahead.
Some 320,000 students ride school buses to schools daily. That doesn't include students who take the bus on field trips and to sporting events. As Capital Journal's Karen Goldsmith reports, caution around these buses is a top priority.
The bus is a very safe vehicle. Where we run into problems is loading and unloading. That's the most vulnerable time for students, is when they're getting on and off of a bus.
The State Department of Education Pupil Transportation Administrator says everyone plays a role in keeping kids on school buses safe.
A lot of responsibility rests on the bus drivers, and they do an outstanding job for the most part across the state in keeping our kids safe.
Before and each year after employment, bus drivers are trained in multiple scenarios. For example,
if there's typically 5 children at that stop and only 4 are there, we try to teach that driver to be aware that another kid may come up late, to search their surroundings before they move that bus. We also do the same thing when they unload. If they unload 3 kids at a stop and they're going to the left across the road, we train them to have the kids stop at the front of the bus, have the driver check their mirrors, make sure traffic is stopped, wave them across, count 3 kids safely away from the street, a safe distance, before they move that bus.
And this is where motorist safety comes in.
A lot of distractions. We're all guilty of it. We all a lot of times have things on our mind. Things are going on with our family. Things are going on with our job. And then you throw cell phones on top of that, radios, eating breakfast on the way to work, running late. All those things, again, compound the situation. My message to motorists would just simply be, when you see a school bus, know that there are students on the ground if it is stopped.
He shares motorists need to keep a safe distance from buses and allow time for the kids to safely get on and off the school bus and out of the street.
We do have instances where people are distracted and will run a bus stop sign because they look up and, hey, the bus is stopped in front of them and don't have time to stop. We have some that blatantly have done that before. They're running late, and we've got videos of cars actually getting up on the sidewalk and going around the bus, knowing kids are on the ground.
State law requires cars to stop for stop school buses that have their stop signs out and lights flashing. And for kids, there are several online resources to teach bus safety, but Carpenter says local school systems are the best resource.
For example, Shelby County, their school system just developed a great video. They use mascots for all their schools, and they talked about bus safety and how they use the mascots as children, if you will, in the video, and basically gave them visuals on how to load and unload safely.
For Capital Journal, I'm Karen Goldsmith.
Recently, we showed you efforts from Montgomery City leaders to help bring economic and residential progress to the entire city by revitalizing some areas on the west and south side of the capital city. Mayor Stephen Reed says the ball is starting to roll with 2 historic areas, the Governor's House Hotel and Normandale Mall, seeing plans for major changes.
Governor's House Hotel just signed a robust check for $100 to purchase that property, and as soon as the title and everything is clear on that, we'll move to start clearing that historic property and demolishing it so that we can put it on the market for development. It's been an eyesore to those who live in South Montgomery, and we know we've got institutional partners both at Trenton State Community College as well as Baptist Health and Alpha that would love to see that property develop into something that fits where we want the southern corridor of the city to go as well.
Normandale came up. There's some newness with Normandale, is it not, sir?
Well, it was recently sold to another owner, and we look forward to initiating conversations with this owner out of Florida. And we had some previous conversations with the owner prior to this sale, which we were just made aware of today. But we want to make sure that their vision for Normandale Mall is in line with ours.
Stay with us. Capital Journal will continue in a moment.
You can watch past episodes of Capital Journal online at video.aptv.org. Capital Journal episodes are also available on APTV's free mobile app. You can also connect with Capital Journal and link to past episodes on Capital Journal's Facebook page. And you can listen to past episodes of Capital Journal when you're driving or on the go with Capital Journal podcasts.
The Alabama Community College system plays a big role in helping students transfer from being a student to the workforce. Joining us now is the head of the Alabama Community College system, Jimmy Baker, Chancellor. So good to see you.
Good to see you. I appreciate the opportunity.
Yes, sir. Now, to let people know exactly what the ACCS is, because a lot of times people may think it's a part of the Department of Education. Not exactly. It works with the Department of Education, but it has a huge role in helping students transfer from being a student into the workforce world, and among other things. Tell us a little bit more about what the Alabama Community College system does, sir.
Well, actually, the Alabama Community College system, we have our own board of trustees. that's appointed by the governor, confirmed by the state senate, and we function separate and apart from the state board or the State Department of Education. But our main mission is to provide an affordable education opportunity for students so that they can either complete a course of study with us for a 2-year period of time and then transfer to a 4-year school at a very economical cost. But many of our students are coming for training. We offer all kinds of certifications that is recognized nationally, so that if you've received training as a welder, it may be that if that's the case, then you get a certificate and you can go to another state or another part of the state, and people understand and appreciate the value of that certification. Something that is kind of probably not noticeable because we're scattered all over the state. We have 24 colleges. We have 88 different instructional sites. And so we're not very far from most anybody at some point in time. But over the course of a year, we will touch about 145,000 students. That's more students that is enrolled in all of the other state 4-year universities that is supported by the state. But a lot of that is part-time. A lot of that is for short courses. We have courses that in some cases are only 3 weeks, but we offer a full selection of courses if you want to pursue a degree, an associate degree. It's been an interesting process.
I'm guessing, like so many other entities around the world, especially here in this country, in Alabama, your job, your task has had some changes due to the pandemic in making sure people can get what they need to get to where they want to go from an educational standpoint, because a lot of things from this point forward have changed, for lack of better words. And I know you're probably bouncing back from that and seeing the numbers increase even more than ever before.
Well, that is true. It has changed education across the country, not just in Alabama, but across the country. Although I still pretty much believe that education is a social environment. You learn not just from the instructor, you learn from other students that you're studying with, that you're being a part of a group with. And so I think we can't totally compensate just for all of that. But we are able and have improved tremendously in delivering over the internet access to an education for a lot of people that heretofore would have never had that opportunity.
And you mentioned so many people, so many locations, so many programs. You also have had the benefit of having more members presidential-wise, chancellor-wise throughout the system to now help balance things out, have you not, sir?
Well, I've been in this office for about a little over 5 years now. When I took office, there were 9 interim presidents. And in many cases, they were in schools that had had an interim president for several years, sometimes as much as 8 or 10 years. Today, we have 24 colleges with 24 presidents. And they're presidents who are looking to make a career of running that community college. They're also presidents that were not necessarily selected by politics. They were selected because they had a commitment, a proven record of success in the world of education and our business. We have a mix of both, but they're committed to making that college a community college. And I stress community because we really count on their commitment to making that college serve the community that they're in, whether it be for academic programs or workforce training skills.
I'm glad you mentioned that because, as you said, you reach out to many areas throughout the state of Alabama, many students, many who are looking for an advancement in what they're doing education-wise, and maybe even a change from what they have been working on. And there are several programs that the ACCS has been working on to help out with that. Some of them have been going on now for the last 2 or 3 years, and they even sprouted out other programs, have they not, sir?
Oh, they have, and we've expanded a lot of additional programs and adding other programs. For example, right now in Mobile, Alabama, we have developed an advanced manufacturing center that's almost ready to open. It will be a showplace for the nation because it's the key location. We have 26 chemical companies located between Mobile and Jackson, Alabama on the Alabama River. They need service. They need to be able to hire people that are trained in the process of creating the chemicals that are needed. And we're standing up a model that has not been replicated across this country. That's one thing, but that's just one. We are adding career programs all across the state. Our goal is to have it readily available within fairly easy reach, serving the communities and their needs so that we are training everyone that is needed in the skills that are used in that area. And we're a long way from being there, but we have, today we have about 18 centers that are being developed at the colleges for the purpose of adding more training and more skills programs.
Is the goal to have 24 colleges? Would you like to have 24 of those centers or even more?
Well, some we already have centers there, like the one I just mentioned that we've already built in Mobile. But yes, ultimately we will have at every school. And then we also join hands with a lot of the high schools, the school systems. And we will be teaching in their schools some of the skills training programs. So we're just trying to find ways so that every citizen of Alabama who needs help can find a way to get that help at a reasonable cost.
Correct me if I'm wrong, that reaching back into high schools in many ways will give students an extra boost and make them more prepared. So by the time they graduate from high school, they already have some credit and some experience at what they need for college.
Well, it's interesting. That is exactly correct. And it's interesting that we now have many times a student will graduate from high school sometime on the same day that they graduate with an associate degree from a community college because they've taken dual enrollment courses while in high school. And if you stop and consider, that cost is a huge assist by the state to fund a student's education. Just think of only having to pay for 2 years of college because you already have an associate degree that was funded through the state appropriations. It's a big plus. And because of that, our enrollment, the pandemic caused nationally a decline in enrollment across the country in community colleges, but also four-year colleges. We didn't have a decline in enrollment. When the state was declining, the national decline was about 3%. We had a 2% increase. I expect even a larger increase this year based on what we're already seeing with enrollment. And we're doing it because of the leadership in every school of a president who is committed to serving that community.
And would you say making these programs and those colleges, your facilities I should say, more accessible and affordable for students a big draw as well, sir?
Oh, it is a big draw. It's a huge plus because, look, what happens in the state, and it's a good thing, it's not a criticism, I hope it's not seen that way. It's we bring in major industry. Toyota, Mazda, for example. They hire a lot of people. Oftentimes, who shows up and is hired by those companies because of the pay scale are people who already had jobs with smaller businesses. Where do they turn? That's a real issue. We are trying to fill that gap, and we work with those associations, National Federation of Independent Businesses, most of the execs of the various associations we work with and help them, and they help us design curriculum that serves their particular needs. And so we're working closely with the associations throughout the state. For example, we've established a CDL training program for commercial driver's license. we are for the first time in the state teaching programs in heavy equipment operation that is needed to hire people to build and pave roads. And so we're looking at construction. We're working with the contractors and trucking association, and we're trying to collect from the community the information about what do you need and help us develop a curriculum so we can teach what is needed.
Chancellor Jimmy Baker of the Alabama Community College System, thank you for your time. And if people want more information, they can go and seek you guys out and talk about some of these other programs you have.
Absolutely.
Okay. Mr. Baker, thank you for your time.
Thank you for the opportunity.
Yes, sir. And Capital Journal will return.
You can watch past episodes of Capital Journal online anytime at Alabama Public Television's website, aptv.org. Click on the Online Video tab on the main page. You can also connect with Capital Journal and link to past episodes on Capital Journal's Facebook page.
The COVID pandemic has had a rough time on jobs across the country, and Alabama is no different. One agency has had the task of making sure people find work and go back to work. The head of that department, the Alabama Department of Labor, is Mr. FITZGERALD Washington, Secretary of the Department of Labor. Mr. Washington, thank you for joining us on Capital Journal.
Well, thank you so much for having me.
We are talking about jobs because, of course, that has been what your agency has been tasked with, and finding people to find work has been a job and a half itself, has it not, sir?
It has been. We're just so encouraged with the strong headwinds that our economy is sort of yielding right now with our economic and workforce development data. As you know, just recently we announced the unemployment rate, which is at 2.6%, which is the historic low for the state of Alabama. So Alabama is certainly open for business.
And that's a number that governmental leaders here in Alabama, our leaders across the country have noticed and said Alabama's doing a good job. So that has to be a good feedback boost, if you will, for the Department of Labor, sir.
Yeah, if you think about the impact that the COVID had on not only Alabama, but all states in the nation, it's just really comforting to know how Alabama has sort of rebounded, especially when you look at the fact that Alabama for 21 months in a row has had the lowest unemployment rate of any of our southeastern states in the area. So that's good news for everybody.
Because we know our neighbors around the state of Alabama are all trying to do what they can. And when you think of Georgia to the east, you think of Florida southeast of us, Tennessee to the north, Mississippi to the west. That's some stiff competition to get people back to work around in this southeastern region, is it not, sir?
Yeah, no question. I'm just so excited about Governor IVEY and our administration that we all are singing off the same hymnal in terms of how we provide services for those who are looking for opportunity.
Well, let's talk about some of those numbers. The numbers itself, 2.6% in July, officials released. A very low, if you will. It's something that a lot of people weren't sure Alabama could get to, let alone maintain, but they have done just that.
Again, think about it. All states struggled during the pandemic, and for Alabama to have maintained the lowest unemployment rate for 21 consecutive months speaks volumes to the current administration. With that number, we know that this is kind of a job seekers market. As you know, we record the number of jobs that are posted, and so right now there's 2 jobs for every 1 person that we report is unemployed, and so there's a lot of opportunity for people that are looking for work.
Also, the reports that we've been reading have said that right around now there are some 59,000 people without jobs statewide right now. More than 2.2 million were working in the state, which is an increase of about 65,000 over this time a year earlier from where we are right now. Great numbers again.
No question. You think of last year around this particular time period, there were more than 80-some thousand people that we reported as unemployed. And so the fact that 2.2 million people have jobs right now, again, is a true testament that our economy is certainly moving in the right direction.
Now, talking about moving in the right direction, one area, Shelby County, just south of Birmingham, had the state's lowest unemployment numbers at 2.1%. That was followed by Coleman and Marshall counties, both at 2.4%. In rural Alabama, western Alabama, Wilcox County had the state's highest at 11.3% near the Black Belt region. But again, everybody's making strides to find work for people and to get people back to work, no matter if it's north, south, east, west, or central Alabama.
Well, no question about it. You just mentioned it. You look at Shelby County, which has the lowest unemployment rate in the state at 2.1%. And Wilcox County, on the other end, has the highest unemployment rate at 11.3%. And all other counties are in between that. And so I really feel strongly that we've got the right ingredients right now to continue that trend moving forward.
What has your department done to help people in terms of helping them find work, but to reassure people that, yes, like you said just a moment ago, there are jobs out there for people. There's work opportunities for people to get back on their feet, get back to work. What is your department doing to help people realize that, sir?
Yeah, we're really proud of our job fair initiatives. In fact, we have job fairs throughout the state. We've had 2 really strong, successful job fairs in recent months, where we recruit a number of employers to meet with job seekers to, again, create opportunity for them to get into the workforce. And so we've been really excited about that. Most recently, we came off a very successful job fair in Birmingham. We held the job fair at the BJCC where we successfully recruited 160 employers. And so hundreds of job seekers came through. And at the end of the day, all of the employers were very satisfied with the people that they hired. A lot of people were hired really on the spot. And so that's one of many things that our agency is doing right now to connect folks that are looking for work. And then not only that, some that are already working, looking to upgrade to a better job. We just create a good opportunity, a platform for them to increase their quality of life.
Also helping them to realize how they could put their best foot forward, their potential that they could bring to some employers. That has to also be a part of the process too of getting people back to work too, sir.
Yeah, and we like to promote the fact that we manage 56 career centers throughout the state. And so let's just say for your job seeker that's looking for some help to give your best presentation to an employer, you can come and talk to one of our professional staffers, again, in one of our statewide career centers to get you upgraded into where you can put yourself in the best position to get that job that you're looking for.
And we know that people are looking at Alabama and the people here who are available to go back to work, and that is also driving people to want to go back to work. But there are still some folks here in this city, Montgomery, and other places. You still see help wanted signs that are up, encouraging people to step out and apply for jobs. That has to be encouraging as well too, sir.
Yeah, we recognize that there's some sectors in our workforce that where the employers are still having challenges hiring and skilled labor. And so I really suggest to those employers to reach out and list those jobs at one of our 56 career centers so that we can look at our job database, do an assessment with the job seekers, and then we can make the referral to hopefully for those employers fill those open positions.
I have to ask you, how is your department doing? Because as we said before, it was no secret your department had a lot of work on its hands over the past almost 3 years due to the pandemic and helping people who lost their jobs find jobs to get back to work. But at the same time, making sure your staff was taken care of, was healthy, and not in any precarious situations. How is everything over at the Department of Labor, sir?
Yeah, make no mistake, our staff really has been challenged over the last 2.5 years, but I'm so proud and I'm so excited and encouraged with how our staff has really stepped up to respond to these enormous demands. We walk around, we try to motivate them as much as we can, and they actually like what they do. So they know that they're here to provide resources and services for people that need it, especially during this particular time. And so that's our charge. And we're going to continue to do that until anybody that's looking for an opportunity get that opportunity.
Some other people who like what you do, lawmakers, I'm quite sure they're watching and paying attention to what's going on and have reached out to want to keep up to speed to help out if need be, because getting people back to work is what they want to see and everyone wants to see in Alabama.
Yeah, part of our strategy, we've identified that there's a couple of different groups that are disconnected from our current workforce right now. Those people with disabilities, those who have been previously incarcerated, and veterans. Those are the 3 areas that our agency is putting some specific focus on to make sure we create an opportunity for them to move into the workforce.
Speaking of those categories of people that you were just mentioning, any programs aimed at those individuals or new programs that you have coming out the pipe with the Department of Labor to actually help with that issue?
Well, I mentioned earlier that our job fair strategy seems to be paying some huge dividends. We typically have what we call customized job fairs specific to those particular areas, so that we let the employers know that in a very challenging workforce right now in this post-pandemic area, they need to look at these three different groups to create an opportunity for them.
Now, we've just moved into fall for the most part, although the weather would indicate otherwise. We passed through the summer. A lot of kids are going back to school, but now we're into the fall. Are you looking to change gears with the Department of Labor of how they approach helping people get back to work and find work, sir?
And we feel like we have a really effective marketing strategy. We don't put all of our eggs in one particular basket because we know people receive their news and information in different areas. And so we're going to continue to raise the awareness and let people know that there are available jobs out there. As I mentioned, job ads, we track those, and there's about a 23% increase in job ads over the months just based on employer needs. And so we want to be able to continue to market those and let people know there's a lot of opportunity out there. And in my opinion, it's working, because all you have to do is look at the number of people that are reported as employed, which also has a direct parallel into why our unemployment rate is at a historic low of 2.6%.
And it's never been that low before, correct, sir?
No, it's a historic low at 2.6%, and so we're all excited about that.
Any idea of if it perhaps proceed and go lower, sir? You think that could happen, perhaps?
Yeah, I mean, we reported that there's 59,000 people that are on the unemployment rolls right now. And so some of those folks may be facing some barriers to get into the workforce. And so that's why it's important for our administration to make sure we raise the awareness from the workforce development side to let people know that these opportunities exist. And so they need some specialized training in a particular area. They can come to one of our career centers statewide and get that extra help to move them off the unemployment ranks into our current workforce.
Now, also, Mr. Washington, I saw some articles in some publications saying that there are a lot of companies around the country that give Alabama some thumbs up for being a prime place to get people back to work because they want to come and relocate and take part of that workforce and what Alabama has to offer in terms of jobs.
Yeah, we're so excited about that. And again, that's a really good sign. We just mentioned some challenges that some employers are facing right now to try to find skilled labor. So our Department of Commerce is doing a wonderful job with recruiting companies outside the state to come to Alabama, and also talking with existing companies about expansion. And so in my opinion, these companies wouldn't look to expand here in our state or come to Alabama to invest their million, sometimes billion-dollar operations if they didn't feel like we didn't have the workforce to satisfy those job descriptions. And so right now, Alabama is a great place to be.
And the Department of Labor is making sure of that.
Yep, we're excited about being part of the workforce arm for the state.
FITZGERALD Washington, Secretary of Labor with the Alabama Department of Labor. Sir, thank you for your time, and we appreciate you coming in and talking about what your department is up to and what's going on in its efforts to help people find work.
Thank you so much again for having me.
Yes, sir, thank you. And Capital Journal will return.
You're watching Alabama Public Television.
Welcome back. When many people think of ALEA, some people say it's just the headquarters for the Alabama State Troopers Division, but it's more than that. And joining us now to talk about ALEA and what it does and some of the functions it takes in its doing its daily duties is the Secretary of ALEA, Hal Taylor. Mr. Taylor, thank you for joining us.
Thank you, Andy. Thank you for having me. I really appreciate that.
You're welcome. When we say ALEA, the first thing that does pop into minds of many people, state troopers, which is a big portion of what ALEA is, but it's not the only thing ALEA does, is it not, sir?
You're correct. So a little history about how ALEA got here. There was a bill passed in 2013 consolidating 12 agencies, which was most state police agencies, and it went into effect January 1 of 15. So that's ALEA, but it's troopers, you know, ABI, what used to be ABI, ABC's, SBI, so ABI now, Marine Patrol, Forestry, CJS, Office of Prosecution Services, Ag and Industry. It was 12 agencies pushed together, so that's how we became ALEA. But there's so much more than just the troopers on the road that you see that we do on a daily basis.
And I guess I should also have said not just troopers, but where you may go to get your driver's license.
Correct, driver's license. So speaking of driver's license, we have it went online, a new driver's license system we worked on for 3 years, and it went up live April 26th. And we have had a huge success with that. The one before had been there so long, we had put Band-Aids on it for years, and IT division and driver's license division said no longer. We've got to have a new system. Some of the hardware and information on there was there back in the 70s. So we had to do something. So I really want to thank the governor and the legislature for the money and the time and effort that they did for us to get that new driver's license system. So it's up and running. What it does is there's so many things that you can do online now with the new driver's license system that in the past you couldn't. You had to go into our office, possibly take a day off, sit and wait on things like reinstatement of your driver's license, changing your address, renewing your driver's license. You can do that online now. And there's a lot of things that CDL drivers can do online now that they used to have to go into the office, submitting physical forms and things like that. So there's a lot of things that they can do now that they do online and don't have to go to the office. So it's been a huge help for us, and it's working really well.
Now, there's the STAR component that you and your department deal with when it comes to licenses and IDs. What does STAR stand for, sir?
Safe, trusted, and reliable. Homeland Security passed a bill, Federal Homeland Security in 2005, wanting all citizens to have a STAR on their driver's license. There are several things that go with that. Documents you must have, Social Security card, birth certificate, things like that. And it is due, you have to have it by May 3rd of 2023. They pushed it down the road several times, one because of COVID, but it takes the place of the passport. If you have a passport, you can still use the passport to fly, but you can use that instead, and also gaining access to federal buildings. That's what it's going to be for as well. But you can go to our office. You have to go to our office, to a Leon office for the very first one, bring the documents in, and to obtain the STAR ID. Once you get it, then you can go online and renew, or go to any other probate judge office or wherever driver's license are issued and renew it. But you have to come to our office first.
ALEA is a very, very busy agency for the state of Alabama. As we start off saying, not just troopers, not just driver's licenses, but there are a lot of other things that ALEA does. From helping investigate crimes across the state of Alabama, to even making patrols on rivers and waterways around the state of Alabama. It's just a conglomerate of several different things that you mentioned before in doing. And a lot of people may not realize that, and are surprised when they hear about some of the things that your agency does.
Right, you're correct, Randy. One particular is our aviation division. So this year we had, at the start of summer, we did 101 days, starting with Memorial Day and leading through the 4th of July, and it will end September 5th on Labor Day. We have Marine Patrol, who are on all the lakes in the state. And then we also this year partnered with Gulf Shores and Orange Beach. And we did something different with our helicopter, our rescue helicopter. We flew up and down the beach during the peak times with these holidays, 4th of July, Memorial Day, and we had a rescue swimmer, rescue diver in the helicopter with us. So as we were flying, we'd get a call that someone had gone out too far, the current had taken them too far, and they were too far to get back in, and they were hollering, for help or asking for help, and they would call us, and then we would go lower down, and the divers would jump out with buoys and life jackets, life preservers, and help them get back to shoreline. This year we had about 16 calls and probably saved several lives of people out there. Just they don't think about the undertow and how quick it can get how far they can get out, and they look back at the shoreline and they get tired real quick. Life jacket or not, sometimes the waves take them under and they can't stay up. So that was a very successful event and project that we did with Gulf Shores and Orange Beach, and we really appreciate them helping us with that.
You mentioned a few holidays recently. We have another one coming up, Labor Day, the official end of summer. You'll have those people trying to get that last hurrah in as summer goes bye-bye for this year. But it doesn't mean that troopers' job, from that standpoint, Aaliyah's job is done, because even more, the highways, traffic, I'm quite sure your staff stays busy with that as well too, and helping people to stay safe.
Yes, you're correct. So we will transition from, we'll still have, of course, Marine troopers on the waterways, but we transition from summer to thinking about school safety. Now you have the buses back on the road. You have kids, all your crosswalks, kids crossing in front of schools and things like that, that are back out there. So we ask people to please don't pass the school bus if they have the arm out loading and unloading kids. Stay back, 20 feet or further so that you can see the kids offload. And once the bus leaves, before you move, make sure you know where the kids are, if they've gotten on or off, or they went in front of the bus, or if they're on the side of the road, or wherever they are before you move. Because they're little kids, and sometimes you can't see them, may be blocked by something. But please be aware of that, and the crossings where they walk across, the speed zones and things like that in front of the school. Just be aware of those. And then also football. We're into college football. We have a couple of college teams in this state that are attended by a lot of people on Saturdays. So please be aware of people traveling to football games, and be responsible. And if you're going to drink and drive, then have a designated driver. So it just transitions to football and school and things like that. But we're out there, and we're here to help, and in anything we can, any way we can.
Real quickly, we'll have a few moments left. Something else that happened with Aaliyah is a gift, if you will, or a donation, or a grant from the governor's office to help the law enforcement agency take care of their workers by keeping them safe, by providing them some hardware to wear to keep them from being in danger if they're out doing their jobs.
Correct. And I want to thank the governor so much for her help in getting us that grant. She gave us a little over $20,000 for bulletproof vests, and that's roughly 30 for us. They're about $550 to $70 a piece. And I really appreciate her giving us that money. That's a huge help. And also Director Boswell from ADECA, the grant, and I really appreciate them helping us with that, because we need all the safety tools that we can get when we're out there working. And a bulletproof vest is one of the number one things that we need. So I really appreciate her helping us with that.
Helping keep safe the ones who help us to stay safe.
Correct. You're right.
Aaliyah Secretary Hal Taylor, thank you for joining us, sir. Appreciate your time.
Randy. Thank you for having me.
You're welcome. We'll check back in with you later.
Sounds good.
Okay. And Capital Journal will continue.
You can watch past episodes of Capital Journal online at video.aptv.org. Capital Journal episodes are also available on APTV's free mobile app. You can also connect with Capital Journal and link to past episodes on Capital Journal's Facebook page. And you can listen to past episodes of Capital Journal when you're driving or on the go with Capital Journal podcasts.
Welcome back. The Alabama Department of Public Health has the task of making sure the state of Alabama stays healthy. In other words, the people of Alabama staying healthy. Leading the Alabama Department of Public Health is Dr. Scott Harris. Dr. Harris, so good to see you. Thank you for joining us, sir.
Sure, thanks for having me, Randy.
First of all, how are you doing, sir? How's your staff over at ADPH?
Thanks. I think we're doing a little better now. We had a couple of really tough years there. We sort of had some time this summer to sort of pause and get some perspective and try to recover a little bit. But we're still not out of the woods, even with COVID, not to mention the other things that are going on. So So our staff continues to work really hard. We have really great men and women who, went into public health not to be, rich and famous, but they just did it because they care about their community, they care about keeping people safe, and they're working really hard, and they're continuing to do that.
You hit the nail on the head. Over the last 3 years, it seems as though this world has been turned upside down due to the coronavirus outbreak, and Alabama was no different from the rest of the states in the United States dealing with it.
Yeah, that's right. It really has been difficult for everyone everywhere. We're not alone, as you say, but I would say we did have some pretty, maybe if not unique challenges, some challenges that not every state had to face. We unfortunately came into this pandemic with a fairly bare bones public health system. We have not funded public health, in the same manner as most of the states in this country do, including the states that surround us. When the pandemic started, we had, a county without even a county health department in it. A lot of our counties, particularly in rural areas, may only have a nurse provider, a couple of days a month. And so that was really not the situation we wanted to be in when the pandemic started. That said, our team really pulled together and worked together really hard, really well. I know there are some terrible things that have happened with the pandemic. We've lost more than 20,000 Alabamians so far to this. And yet, we do feel like we had a lot of successes to celebrate. We were able to keep our healthcare system up and running. Our hospitals are still functioning. Societies still standing, and schools are running again. So there are a lot of ways that we're very proud of the work that we've done.
Because this is unlike anything anyone had ever seen before.
Oh yeah, nobody could have really seen this coming. I guess the Spanish flu pandemic in 1918, 1919 would be the other comparison. I don't remember that. I don't think you remember that.
Oh no.
But really, there's nothing else like that we've ever seen. For 2 straight years now, in 2020 and in 2021, Alabama has had more deaths in our state than we have had births. And that has never happened before in the history of our state. That's the first time that's ever happened going back to the 19th century, and yet we did that for 2 straight years. And it's attributable to the number of people who died for COVID. As I just mentioned, we passed the 20,000 mark recently. That's much more deadly than any other outbreak we have ever experienced in the history of our state. And when you look at total numbers of deaths, it's more deadly, of course, than the Spanish flu pandemic. Obviously, we're a larger state now than we were then, but the death rates are about the same. Death rates are about the same. It's just been a really terrible time.
So here we are, speaking of time. We are in August going into September 2022. A new school season is starting. In a lot of places across the United States, some COVID advisories have been lessened, even here in Alabama to an extent. We've said this before. People should keep their eyes and ears open, and even though you're given the okay to back off on some things, you still should practice safety first?
Oh, absolutely right. And certainly there's risk that's determined by, who you are yourself. What's your age, what are your, medical conditions, what's your vaccination status. All those things have to go into, those kind of decisions. We do have to get back to some sense of normalcy. I mean, clearly everybody understands that we're living with this disease, but it would be a mistake to think that it's gone away and that it's not a problem anymore. And I know I sound like a broken record, but I just try to use every chance to reiterate the single most important thing you can do to protect yourself and to protect the people around you is to get vaccinated. We know that even from the Omicron outbreak, that the surge that happened back in January and February, that strain of the virus was probably not as deadly as some of the ones that we've seen before, and yet people who were unvaccinated were 22 times more likely to die than people who were fully vaccinated and boosted. That's CDC numbers from about 22 different states, including Alabama. So 22 times more likely to die if you're unvaccinated. I don't know how anybody can hear that number and not, pull the trigger on getting vaccinated, but that's the single most important thing that people can do.
One other thing that has been advised from the get-go almost, the mask. It still helps. they still help, I should say.
Yeah, sure. I think that we moved away from requiring people to have masks, but clearly masks make sense in a lot of situations for people. I would say for most Alabamians, if you're not interested in wearing a mask, then you're free to make those decisions. But let's not stigmatize those people who do. There are people out there with immune system issues who can't be vaccinated. They can't really protect themselves with a vaccine. Those are the kind of people who continue to wear a mask. There are people who are just older or who have chronic health problems, and maybe they're vaccinated or maybe not, but they still choose to wear a mask, and I think that they ought to be allowed to do that if they choose to do that.
As I said before, we've moved into a new season of the year here in Alabama. We're in the early stages of fall. A lot of times people think about other illnesses that can occur, such as the flu, pneumonia with fall weather coming in. Is there a difference between COVID, the flu, and pneumonia? Other than the fact that still we all need to be very prepared and be careful of any of those things I just mentioned.
Yeah, they do have some similarities, but there are a great deal of differences too. First of all, remember that with COVID, this is a new virus that, as far as we know, had never existed before. Until 2.5 years ago, it didn't even have a name. No one had any idea what it was. The flu is different in that we have a lot of experience with the flu. We can anticipate each year usually pretty well what type of flu strains we're going to see in advance. The flu travels around the world seasonally in a certain way, and so the flu viruses that are going on in our summertime in the southern hemisphere are the ones that we're likely to see here in this country when our traditional flu season gets here. So we can prepare for that. We can make vaccines ahead of time that most of the time are protective for that. We also have had a lot of experience in treating the flu with certain types of medications. There are many antiviral medicines out there. Most of us have maybe taken Tamiflu at one time or another. So in a lot of ways, even though the flu is a similar type illness, it's something that we're much better prepared for and have been for a long time. Additionally, in a typical year, we might have 100 adult flu deaths in our state, 100 in a year. Compare that with, as I mentioned, about 10,000 a year for the last 2 years with COVID. So even though the flu can make people pretty sick and fill up hospital beds sometimes, it's just not the same illness. It doesn't cause as severe disease as we've seen with COVID. Pneumonia is another diagnosis that can be caused by a lot of different things. Flu can cause actually pneumonia, and COVID can cause pneumonia, just like there are a lot of other viruses and bacteria that can. Pneumonia is really more of a diagnosis. There is a so-called pneumonia vaccine, but that actually just protects against one particular type of bacteria that causes pneumonia, called the pneumococcus. So those terms get interchanged a lot, and again, those diseases all do have some similarities, but there's some real important differences also.
One of the most important things, if you feel sick, stay at home until you feel better.
Yeah, but that's so simple, and we've had a really hard time communicating that. I think all of us like to feel we're indispensable, and so no one at work can do without us. And if I just have a little cold, I can still work. And we do that sometimes, but honestly, it's not the smart thing to do. Particularly while COVID is still going around, we're getting 2,000 or 3,000 cases a day still, every single day of COVID, just that we know of, and there's some we don't. So if you have any type of illness at all, if you're concerned at all, please do a quick COVID test at home. Just do a rapid antigen test. Make sure you don't have COVID. If you have fever, we all learned in kindergarten, you need to stay home till it goes away. You don't need to be around other people.
In the remaining time we have, Doctor, something else I want to talk to you about, the rise, if you will, of monkeypox. That has taken the nation. As soon as people think, well, okay, COVID, we can breathe a sigh of relief, here comes monkeypox.
Yeah, monkeypox is probably the last thing we ever expected to be talking about, here in 2022. It was one of those diseases that we learned in school and never heard from again. But there has been a really large outbreak around the world, around 15,000 cases so far here in this country. In Alabama, we've only so far identified between 30 and 40 cases to this point, but states around us like Georgia and Florida are in the top 5 nationally for cases. Both of those states have well over 1,000 cases. So we are making vaccine available. We have a limited supply nationally, but here in Alabama right now we have a lot of vaccine available. So far the people most at risk for this disease have been men who have sex with men. This is reminiscent somewhat of the HIV epidemic. You know, when I first started my career, 30 years ago, we were having these same kind of conversations. We hope people understand that while this is the group that's at risk right now, these diseases don't really check your ID but before they infect somebody. They can end up anywhere, and to this point, in fact, we've had one pregnant woman here in Alabama who's been infected. We know of children who have been close contacts to cases, and not actual cases to this point. So we do expect that this is likely to end up in other populations. We're fortunate in that we're not seeing deaths from this, and so it doesn't have quite the same sense of urgency perhaps with some people. But this can be a disease that causes a lot of pain and discomfort and tends to take you out of circulation for a few weeks while you recover. So we hope people aren't alarmed by this, but just aware, try to learn about this, try to understand what the risk factors are, and you can make a determination about whether you need to be vaccinated.
And the Alabama Department of Public Health will keep watching that, as well as COVID and other conditions that could affect citizens of Alabama.
That's what we're here for.
Okay. Dr. Scott Harris, who leads the Alabama Department of Public Health, thank you, sir, for your time.
Thank you, Randy. Good to be here.
Yes, sir. And Capital Journal will continue.
At 2 p.m. on February 16, 1968, the very first 911 call was made in Haleyville, Alabama. The call was made by State Representative Rankin Veit from Haleyville Mayor James Witt's office and was answered by U.S. Representative Tom Bevel at the Haleyville Police Station on a bright red telephone that was given to the city by the Alabama Telephone Company. Haleyville still celebrates their part in 911 history with an annual festival.
That does it for this edition of Capital Journal. Join us again next week for the latest in statewide news. Todd Stacy will be back in this chair next Friday. For all of us here at Alabama Public Television, thank you for tuning in. Take care of yourselves, and please be safe.